Hello, I'm Tom Davis, Partnership Leader for Health and Nutrition with World Vision International, and this presentation is on World TB Day, a day to remember the ongoing preventable deaths of children. There are approximately 1.1 million TB infections in children under 15, leading to 230,000 deaths in 2020. The case fatality rate is incredibly high, 43.6%, and 96% of children who die receive no treatment at all. MDR-TB affects 25,000 children a year as well. The official estimates make tuberculosis the sixth highest cause of death in the 1 to 59-month-old age group, causing more deaths than meningitis, AIDS, measles, and pertussis. However, we know that some deaths ascribed to pneumonia, meningitis, and AIDS may have been caused by tuberculosis. Even with good vital registration systems, the ICD-10 coding system rules state that tuberculosis should not be registered as the primary cause of death when another comorbidity such as HIV is present. And secondary causes of death are not relayed to supranational bodies. Added to that, verbal autopsy has limited sensitivity for tuberculosis deaths, especially in children because of diverse and nonspecific signs and symptoms. So we know that many tuberculosis deaths in children are probably not represented in these very high global mortality estimates, and thus the overall number of pediatric TB deaths may be much higher than the official tally. I've been fighting tuberculosis since I began my public health work back in 1983, working with International Child Care's Croisade Anti-Tuberculose, or CAT, as a manager of the work in the southern peninsula of Haiti. ICC led the way on TB in Haiti, running the largest TB hospital for children, conducting the first mass vaccination with BCG of more than 3 million people in the country, supporting diagnosis and treatment of TB in more than 100 clinics throughout Haiti, and doing case-finding treatment and education programs. Even back then, we realized that TB was not just a medical problem, but a social one that required a multi-sectoral approach to decrease poverty and stigma. And I believe we may need to do more to address the multi-sectoral aspects of TB. TB in Haiti back then was referred to as maladie ticaille, or little house disease, since TB patients were often isolated from the family and required to live in a small hut behind their main house. It was called maladie épaules carrées, or square shoulder disease, since so many TB patients were malnourished and their bony shoulders were prominently visible through their shirts due to malnutrition. We know that depression is sometimes a comorbidity with TB as well, making it more difficult for patients to stay on their medications. When we look at the 2018 to 2020 period, note that the UN treatment target for children is only about 70% of all infections to begin with, and then the achievement against the target is 41% at the 4-year mark out of 5 years. So we're still way behind on this. Within World Vision's Global Fund portfolio for TB over the last 5 years, 326,000 patients we saw 326,000 patients of all forms of TB cases were reported to the National Health Authority. 125,000 TB patients were enrolled in directly observed therapy for TB. World Vision's TB work, of course, expands beyond our Global Fund portfolio, and we look forward to hearing today about the non-Global Fund TB work that's being done in India, for example. In our Global Fund programs, our TB interventions focus on community system strengthening using a social mobilization approach to increase early detection of all forms of TB, enrollment to treatment, and the management of MDR-TB and HIV-TB co-infection. World Vision's results are not disaggregated for children, unfortunately. We've listened to your common challenges in addressing TB for children as shared by the WHO. For example, TB illness in children is often missed or overlooked due to non-specific symptoms and the lack of a sensitive and child-friendly diagnostic test. Health workers in TB programs and other health services often lack sufficient knowledge and capacity for prevention, diagnosis, and management of childhood TB. Systematic screening for TB and isoniazid preventive therapy, or IPT, for children under 5 years of age and children living with HIV are rarely implemented or reported. There's a lack of community knowledge and engagement, and until recently, no child-friendly formulations were available, and there are no child formulations of second-line TB drugs as well. The current TB vaccine, BCG, protects young children against the most severe forms of TB, like Pott's disease, but does not prevent the transmission of TB from an infectious contact. At the end of our session today, our colleague Adunya Kabeni will share his reflections on actions for improving our TB interventions. As I hope you're all aware, this is a framework for our new health and nutrition strategic approach. And note that while TB intervention has been highlighted for adolescents 12 to 18 years, but it wasn't specifically for pregnant and lactating women or children 1 to 59 months, but we probably need to do that. I would like to suggest on this World TB Day that we acknowledge the magnitude of this disease also on younger children especially, and improve our strategic prioritization and investment in TB prevention and treatment. As we go into the presentations today, we want to ask you to consider taking the following actions. First, assimilate the WHO 2021 revised TB guideline into your programming. Secondly, review the WHO multi-sectoral accountability framework to accelerate progress to end TB. Third, we need to integrate TB interventions for children across our core maternal and child health platforms. And lastly, we need to integrate TB interventions through our other sector platforms, such as nutrition, WASH, livelihoods, education, and child protection. Thank you.